The scapula is usually limited, partly because it's starting too far, it's stuck in the mud down, and it's not starting in the right position. And then the muscles that activate and move the scapula upward rotation to rotate it upwardly aren't activating and functioning strongly. They're not recruited enough. And then there's also soft tissue restrictions that are limiting the motion on top of that. And therefore, the rotator cuff has to compete against those things to move your arm overhead enough. And imagine doing that repetitively with like shoulder press and jerk press and snatches and hang cleans, power cleans to jerk press, stuff like that. Military press, right? Incline push-ups, incline bench, repetitively over and over again, right? And then if the glenohumeral joint isn't rotating enough too because of soft tissue restrictions, that's also going to be limited, and the rotator cuff has to compete against that also. All right, so to get full overhead range of motion, a person needs 180 degrees straight up and down with their arm, okay? They also need to get enough full external rotation of their arm, all right? Their arm has to rotate externally, if you think like longitudinally overhead, and then their elbows need to get fully straight. So here's a quiz question, try right now. Can you reach your arm straight overhead and get 180 degrees with your elbows straight and your hand rotated outwards? If the answer is no, then you're not getting full range of motion. I haven't really met one person yet. I haven't met many people. I probably have, but I haven't met many people that can do that. So it's kind of uncommon. So imagine then an athlete who needs to get overhead with shoulder press, jerk press, or snatches, push press, incline bench, whatever. They need to get fully overhead, but they're limited in range of motion in their shoulder. Where's the rest of the range of motion going to be made up for? What they do is they're usually hypermobile in their shoulder joint. They hyperflex in their glenohumeral joint because the scapula can't continue. And then in addition to that, they hyperextend their lumbar spine, their low back. So they extend their low back, and then their shoulder joint itself will hyperflex, okay, because of lack of mobility elsewhere. That's going to create a cascade of things that are going to overcompensate and get irritated in your low back and in the shoulder joint itself, okay?